I want to start today's video with a question. It is a question I know many men over 60 have asked themselves, privately and quietly, perhaps without ever feeling that there was a genuinely safe or knowledgeable person to ask it of. The question is this: what actually happens to your body if you ejaculate every single day? Not once in a while, not occasionally, every single day, consistently, over weeks and months and years. Does it benefit your health, or does it quietly deplete you? Does it protect your prostate or put it under unnecessary strain? Does it affect your testosterone, your energy, your mental clarity, your mood, your drive? And perhaps the most practically important question of all, does the answer change after 60? And if so, how? These are legitimate, serious, clinically important questions. And if you have wondered about them, even privately, even with some discomfort at the wondering itself, I want you to know something immediately and without qualification. There is nothing strange or inappropriate or undignified about a man over 60 thinking carefully about his sexual health and how it relates to his overall well-being. It is, in fact, one of the most intelligent and proactive things you can do for your health in this stage of life. Because sexual health in men over 60 is not a separate or peripheral concern. It is woven directly into your cardiovascular health, your hormonal health, your prostate health, your mental health, and your overall quality of life in ways that mainstream medicine has been frustratingly slow to address honestly and directly. I am Dr. Julia Rhodes, a men's sex therapist with over a decade of experience working with different couples and helping men regain their sexual health and strength back. In my clinical work, I have sat across from men in their 60s, 70s, and 80s who have been carrying questions exactly like the one I opened this video with for years, sometimes decades, without ever receiving a satisfying answer. Men who were given contradictory advice from different sources. Men who were made to feel embarrassed for asking. Men who simply stopped asking and made do with silence and uncertainty. Today, I want to give you the honest, evidence-based, clinically grounded answers that you deserve. And I want to do it in the same direct, respectful way I would speak to a patient sitting across from me, without judgment, without moralizing, and without simplifying the complexity of what is actually happening in your body. Before we get into the content, please subscribe to this channel right now if you have not already, and turn on your notifications. Every week, I publish content specifically designed for men who take their health seriously and want real information rather than vague reassurances or moral lectures disguised as health advice. If today's video gives you something genuinely useful, please share it with a man in your life who would benefit. And now, let us get into what you came here for. The myth landscape, clearing the fog before we begin. If you are a man over 60, you have almost certainly been exposed to conflicting and extreme claims about ejaculation frequency from multiple directions over the course of your life. You have probably heard that daily ejaculation is a sign of robust health and should be maintained as long as possible. You have probably also heard the opposite, that frequent ejaculation drains vital energy, depletes testosterone, exhausts the body, and should be reduced or eliminated as men age. You may have encountered religious or cultural messaging suggesting that any sexual activity beyond procreation is damaging to a man's health or character. You may have encountered equally extreme secular messaging celebrating maximized sexual activity as an unambiguous health benefit. Here is the clinical reality that both extremes miss. Daily ejaculation is neither automatically beneficial nor automatically harmful. The answer to the question of whether it is good or bad for your body at this stage of life is genuinely individual. It depends on your specific physiology, your recovery capacity, your hormonal profile, your prostate health, your cardiovascular status, and, crucially, how your body is actually responding. There is no single correct frequency that applies universally to all men over 60. What there is, and what I want to spend the majority of this video teaching you to understand and use, is a set of biological signals that your body produces to tell you whether your current pattern is serving you or straining you. Learning to read those signals honestly, without shame and without judgment, is the most important sexual health skill a man in this age group can develop. What actually happens in your body when you ejaculate? Let us start with the physiology, because understanding what is actually happening biologically is the foundation of everything else. When sexual arousal builds toward ejaculation, the brain begins releasing a cascade of neurochemicals. Dopamine, the primary neurotransmitter of motivation, anticipation, and reward, surges significantly in the period leading up to and during orgasm. This surge is what creates the powerful feeling of pleasure and the sense of drive and engagement that accompanies sexual arousal. Oxytocin, sometimes called the bonding hormone, is released during and after orgasm and creates feelings of warmth, connection, calm, and emotional closeness. Endorphins, the body's endogenous opioids, are released during orgasm and contribute to the feelings of physical pleasure and the reduction of pain and stress that follow. And prolactin, a hormone that promotes feelings of satiation and deep relaxation, rises significantly following orgasm and is one of the primary biological mechanisms behind the calm, settled feeling that most men experience in the period after ejaculation. From a cardiovascular standpoint, sexual arousal and orgasm produce a meaningful, though brief, increase in heart rate and blood pressure, followed by a return to baseline that constitutes a form of mild cardiovascular exercise. The pelvic floor muscles contract rhythmically during ejaculation, providing a form of exercise for muscles that are critically important for bladder control, core stability, and erectile function. The prostate gland expels accumulated secretions, which, as I discussed in detail in a previous video, is important for prostate health and the prevention of the kind of prostatic fluid stagnation that is associated with inflammation and increased risk of prostate conditions. All of this, in the right context and at the right frequency, is genuinely good for you. Regular ejaculation supports cardiovascular health, prostate health, pelvic floor function, neurochemical balance, and mood. The clinical evidence for these benefits is solid, and I do not want to understate it. However, and this is the part that is most relevant to men over 60 specifically, all of these benefits are contingent on adequate recovery. And recovery changes meaningfully as men age. How recovery changes after 60, the crucial variable. After 60, several physiological variables shift in ways that directly affect how your body responds to and recovers from ejaculation. Testosterone production declines. Testosterone is the primary androgenic hormone in men, and it plays a central role in libido, energy, muscle recovery, cognitive clarity, and mood. In men over 60, baseline testosterone levels are typically 30 to 50% lower than they were in early adulthood. The rate at which testosterone production recovers following sexual activity is slower. The refractory period, which is the biological recovery window that follows orgasm, lengthens considerably compared to younger years, and the physiological processes that occur during that window, including hormonal rebalancing and neurochemical restabilization, take meaningfully more time to complete. This does not mean that ejaculation becomes harmful after 60. It means that the system requires more space between sessions to return to a fully recovered and replenished baseline, and that exceeding that recovery capacity consistently will produce symptoms that are both real and worth paying attention to. Nervous system sensitivity and regulatory capacity change as well. The autonomic nervous system, which governs the transition between the aroused, sympathetically activated state of sexual engagement and the calm, parasympathetically activated state of rest and recovery, operates more slowly and requires more recovery time in older men. When ejaculation occurs more frequently than the nervous system can fully recover from, the cumulative effect is a sustained elevation of the kind of neurological strain that manifests as fatigue, mental fog, reduced motivation, and irritability. Pelvic floor muscle recovery follows the same principle as every other muscle group in the body. The muscles involved in ejaculation, including the bulbocavernosus and ischiocavernosus muscles of the pelvic floor, require adequate recovery time between intensive contractions. In younger men, this recovery is rapid. In men over 60, it is slower, and insufficient recovery creates the kind of cumulative pelvic floor fatigue and tightness that can manifest as discomfort, reduced ejaculatory force, and in some cases, worsening urinary symptoms. None of this means that daily ejaculation is categorically inappropriate for men over 60. It means that for some men in this age group, daily frequency exceeds their individual recovery capacity, and the critical skill is learning to distinguish between a frequency that is supporting your health and one that is quietly straining it. The 5 most common mistakes men over 60 make. In my clinical work with men in this age group, I see the same patterns come up repeatedly. I want to walk you through the 5 most common mistakes in reverse order of seriousness, because understanding them will give you an extremely clear and practical framework for evaluating your own situation honestly. Mistake 5. Confusing habit with genuine desire. This is one of the most important and least discussed aspects of sexual health in men over 60, and it is also one of the subtlest. True desire, the kind that emerges naturally from your hormonal state, your emotional readiness, and genuine physical arousal, feels qualitatively different from habitual sexual activity that has become part of a routine, regardless of how you actually feel. In younger men, hormonal drive is typically robust enough that habitual and genuine desire are rarely far apart. In men over 60, with naturally lower testosterone and a more sensitive nervous system, the gap between genuine desire and habitual behavior can become significant. When ejaculation occurs primarily out of habit, out of boredom, out of routine, or as a reflexive response to availability rather than genuine arousal, the dopamine system responds differently than it does to genuinely desired and fully present sexual engagement. The reward is shallower. The neurochemical benefits are reduced. The satisfaction is lower. And over time, the pattern can create a kind of dullness around sexual activity, a going through the motions quality that diminishes both the pleasure and the health benefits simultaneously. The practical remedy is deceptively simple. Pause occasionally and let genuine desire reassert itself naturally. Allow a day or two, or longer if needed, between sessions. Notice whether desire returns spontaneously and with genuine energy, or whether it remains flat even after a period of abstinence. That observation is enormously informative. Spontaneous desire returning with authentic energy is your body telling you that your current frequency and your baseline hormonal state are in reasonable alignment. Persistent flatness, even after rest, may indicate that your frequency has been suppressing rather than expressing your natural desire cycle. Mistake 4. Using ejaculation as a primary stress management or emotional regulation tool. This shift is one that many men do not recognize consciously because it often happens so gradually that there is no clear moment at which it becomes apparent. What began as sexual desire shifts, slowly and invisibly, into a coping mechanism. The behavior persists, but what it is responding to has changed. It is no longer primarily serving desire or connection or pleasure. It is primarily serving stress relief, distraction from loneliness or boredom, or emotional numbing. The dopamine release associated with orgasm does temporarily reduce the subjective experience of stress and emotional discomfort. This is real and physiologically documented, but it does not address the source of the stress or discomfort. The underlying cause remains unchanged, and the relief is transient. Over time, when ejaculation is used primarily in this way, two things tend to happen. The dopamine response becomes progressively less effective at producing the relief being sought, which drives increasing frequency in an attempt to restore the effect. And the underlying stressors or emotional needs continue unaddressed, sometimes worsening in the shadow of a coping behavior that is successfully masking them without resolving them. The question I encourage the men I work with to ask themselves, honestly and regularly, is this: what am I actually responding to right now? Is this genuine desire? Is this connection seeking? Is this stress relief? Is this loneliness? Is this boredom? Not to judge any of these answers, but to understand them, because different underlying needs require different responses, and the body's long-term health is best served when those needs are recognized and addressed directly, rather than managed through a single coping mechanism, regardless of what the underlying need actually is. Mistake 3. Ignoring your prostate's feedback signals. Regular ejaculation is genuinely beneficial for prostate health. I have discussed this extensively in previous videos, and the research supporting this is solid. Regular ejaculation expels accumulated prostatic secretions, reduces inflammatory stagnation, and is associated with lower risk of prostate cancer in multiple large longitudinal studies. However, more is not always better, and this principle applies with particular force in men who are already dealing with prostate issues. Benign prostatic hyperplasia, which is the age-related enlargement of the prostate that affects a significant majority of men over 60, makes the prostate gland more reactive to stimulation. Prostatitis, which is inflammation of the prostate that can be either bacterial or non-bacterial in origin, similarly increases the sensitivity and irritability of the gland. In men with either of these conditions, daily ejaculation can in some cases exceed what the prostate gland can comfortably accommodate in terms of repeated stimulation cycles, leading to increased inflammation, worsened urinary symptoms, and pelvic discomfort. The biological feedback that your prostate provides is both real and important to listen to. Pelvic heaviness or discomfort in the days following ejaculation, worsening of urinary stream, increased urinary urgency or frequency, or a persistent sense of incomplete bladder emptying are all signals that deserve to be taken seriously rather than ignored or pushed through. These signals do not necessarily mean you need to stop. They mean you need to reduce frequency and observe whether the symptoms improve. For most men with prostate concerns, a frequency of 2 to 4 times per week represents a useful and sustainable balance between maintaining the health benefits of regular ejaculation and giving the prostate adequate recovery time. If you are experiencing urinary symptoms that are new, worsening, or that concern you in any way, please speak with your doctor rather than self-managing on the basis of any advice, including what you hear from me. Urinary symptoms in men over 60 deserve clinical evaluation, not just frequency adjustment. Mistake 2. Overworking the pelvic floor without adequate recovery. The pelvic floor is not a switch. It is a group of muscles, and like every other muscle group in the body, it requires a balance of use and recovery to remain healthy, functional, and strong. The rhythmic contractions of the pelvic floor that occur during ejaculation are, as I noted earlier, a beneficial form of exercise for these muscles. But the principle of progressive overload and adequate recovery that applies to every other form of exercise applies here as well. In men over 60, pelvic floor muscle recovery is slower than it was in younger years. When ejaculation occurs daily without adequate rest, the cumulative effect on the pelvic floor can include chronic tightness of the pelvic floor muscles, which paradoxically reduces rather than enhances sexual function, bladder control, and pelvic comfort. A chronically tight or hypertonic pelvic floor can cause or worsen urinary urgency, difficulty initiating urination, pelvic pain, and reduced sensation during sexual activity. The complementary practice of deliberate pelvic floor strengthening through Kegel exercises, combined with adequate rest between ejaculatory episodes, represents the optimal approach for maintaining pelvic floor health in men over 60. Kegel exercises, performed correctly and regularly at times separate from sexual activity, build the baseline strength and neuromuscular control of the pelvic floor in a way that makes the contractions of orgasm feel stronger, more satisfying, and more physiologically beneficial. 3 sets of 10 sustained contractions, held for 5 seconds each, performed daily, is a good starting point for men who have not previously incorporated pelvic floor training into their routine. Mistake 1. Allowing shame and outdated beliefs to govern your relationship with your own body. This is, without any question, the most damaging mistake on this list, and it is the one I want to spend the most time on because it is the one that causes the greatest harm and the one that is almost entirely invisible in mainstream health conversations. The shame that many men over 60 carry around sexual desire, sexual activity, and sexual self-care is not the result of personal weakness or moral failure. It is the accumulated product of decades of cultural messaging, religious framing, social norms, and the silence of a medical system that has historically treated sexual health as a peripheral or inappropriate topic in older men. Men are consistently given the implicit message that desire and sexual activity are appropriate in younger men, but become increasingly undignified, inappropriate, or suspicious as men age. That a man over 60 who still has active sexual desire and engages in regular sexual self-care is somehow doing something questionable that he should keep private and feel ambivalent about. This message is not just wrong, it is physiologically harmful. The stress response that shame and anxiety activate in the body is directly and measurably damaging to precisely the hormonal and vascular systems that support sexual health. Shame increases cortisol. Sustained elevated cortisol suppresses testosterone production, impairs vascular function, disrupts sleep, elevates blood pressure, and promotes the very physiological deterioration that men over 60 most need to protect against. The act that the shame is responding to may be entirely neutral or even beneficial. The shame itself is actively harmful. The men who age with the greatest vitality, sexual health, and quality of life are not necessarily the men who exercise the most or eat the most perfectly formulated diets, though those things matter significantly. They are the men who have developed a relationship with their own bodies that is characterized by honest listening, attentive responsiveness, and genuine self-respect. Men who treat their own physiology as worthy of attention and care, rather than as something to be managed in secrecy and judged against external standards that were never calibrated to their actual biology. Your practical framework going forward. Based on everything I have shared today, here is the practical framework I give to the men I work with clinically. Begin by paying genuine, non-judgmental attention to how you feel in the 24 to 48 hours following ejaculation. Not immediately after, when the neurochemical afterglow is still present, but later. Your energy levels in the afternoon and evening of the same day. Your mental clarity and focus when you sit down to do something that requires concentration. Your motivation to engage with the people and activities that matter to you. Your pelvic comfort throughout the day. Your sleep quality that night and the following night. Your mood and emotional engagement the following morning. These are the biological readouts your body is producing for you, and they are more informative and more personalized than any general frequency recommendation I or anyone else could offer you. If you consistently feel energized, mentally clear, emotionally engaged, comfortable in your pelvis, and well-rested following your current frequency, your body is telling you that this frequency is within your individual recovery capacity. There is no clinical reason to change anything. If you consistently notice fatigue that lingers, mental fog, reduced motivation, pelvic discomfort, worsening sleep, or emotional flatness following your current frequency, your body is telling you that recovery is insufficient. Reduce frequency, observe whether those symptoms improve, and find the level at which you feel genuinely well rather than mildly drained. Support your recovery actively. Sleep is the most powerful recovery tool available to you, and it is also the most directly connected to testosterone production and hormonal restoration. Prioritize it non-negotiably. Hydration, a nutrient-dense diet with adequate zinc and protein, and regular physical activity all contribute meaningfully to your recovery capacity and to the quality of your sexual health overall. And release the framework of shame and moral judgment entirely. Replace it with the framework of honest, curious, non-judgmental, biological self-observation. Your body is not your enemy. It is not punishing you or rewarding you. It is giving you information, continuously and faithfully, about what serves it and what strains it. Your job is to listen to that information and respond to it with the same intelligence and care you would bring to any other dimension of your health. That is the whole practice. It is simpler and more empowering than decades of conflicting cultural messaging may have led you to believe. If today's video gave you clarity on a topic that has been unnecessarily confusing or carried unnecessary shame, please do 3 things right now. Hit the like button because it helps more men over 60 find this content at exactly the moment they need it. Leave a comment below and tell me what part of today's video shifted something for you. And if you are not yet subscribed with notifications on, please do that now, because every week I am here with the honest, evidence-based, judgment-free conversations about men's health that you deserve to be having. I am Dr. Julia Rhodes. I will see you in the next video.